Hello guys and welcome to my YouTube channel. Today we gonna see frequently asked surgery questions for clinical year students. If you're new, please subscribe, like, and share my videos. Free air under diaphragm. Always check thin layer of air or radiolucent rim under diaphragm. The left gastric air shadow is usually normal, but the right free air under diaphragm is always abnormal. Differential diagnosis for free air under diaphragm: perforated peptic ulcer disease, penetrating abdominal trauma, bowel perforation, recent abdominal surgery or laparotomy, etc. Sigmoid volvulus. Sigmoid volvulus is the most common cause of obstruction in Ethiopia, probably due to high-fiber diet and flatus theory. X-ray findings of large bowel obstruction, peripherally located fewer air fluid levels, visible haustral markings, larger bowel diameter, omega sign or inverted U sign. Management principles: first, open intravenous lines and resuscitate with crystalloids, insert urinary catheter and follow urine output, insert NG tube for decompression, remember as 3 tubes, intravenous line, nasogastric tube and urinary catheter. Start antibiotics, always cover aerobic and anaerobic microorganisms. If the obstruction is simple or viable, rectal tube deflation can be tried. Otherwise, exploratory laparotomy should be done. Pneumothorax. Look at the image. Right lung is collapsed. Compare the two sides. The right lung field is radiolucent, but no rib fracture or subcutaneous emphysema. General management principles for pneumothorax: tube thoracostomy or chest tube insertion, adequate pain management, and chest physiotherapy. Chest tube insertion site or safe triangle: made bilaterally anterior border of latissimus dorsi muscle, medially lateral border of pectoralis major muscle, and below by nipple or fifth intercostal space. Chest tubes usually has multiple fenestration on one end and blind on the other end. General indications for chest tube insertion: pneumothorax, hemopneumothorax, empyema, unstable penetrating chest trauma, chylothorax, malignant pleural effusion, etc. Chest tube removal criteria: clinically stable patient with adequate air entry, chest X-ray with no residual pneumothorax or expanded lungs, tube drainage less than 200 ml per 24 hours, no bloody or purulent drainage. Urinary catheter. Indication for urinary catheterization: any major surgery, acute or chronic urinary retention, coma or quadriplegic patients, to monitor urine output in dehydrated and or shocked patients, etc. Urinary catheter can be 1 way, 2 ways, or 3 ways. 3 ways catheter has drainage channel, irrigation channel and inflation channel. Tracheostomy tube. Tracheostomy tube can be cuffed or non-cuffed. Indication for tracheostomy: prolonged intubation, upper airway obstruction secondary to face trauma or head and neck tumors. Bilateral recurrent laryngeal nerve injury and thyroid surgery or neck dissection, etc. Oral airways. Used to keep airway patent in unconscious or lethargic patients. Rectal tubes. Used to deflate simple sigmoid volvulus, or to do enemas. NG tube used for decompression, feeding, lavage or to give PO medication. Silk is a natural, non-absorbable suture material. Vicryl is a synthetic, absorbable suture material. Catgut is a natural, absorbable suture material. Alice forceps. Alice forceps used to raise flaps in thyroid and breast surgeries. Scalpel or blade holder, also called surgeon's knife, usually after assembled with the blade. Towel clip hold drapes in place to expose only the operation site. Needle holder used to hold the needle and suture. Needle holder has short jaw and groove. Pickup forceps can be toothed or non-toothed. Non-toothed pickup used to hold delicate structures like bowel or vessels. Toothed pickup used to hold skin, fascia or any other non-delicate structures. Artery forceps can be straight or curved, can be small as mosquito artery or big as Kelly artery. Artery forceps used to clamp bleeding vessels to secure hemostasis. Babcock forceps used to hold delicate structures. For example, bowel tissue. Kocher forceps used to hold tough structures. For example, fascia during abdominal wall closure. Langenbeck retractor. Used to retract wound edges for better visual access. Scissors can be curved or straight. Usually curved scissors are tissue scissors used to cut or dissect tissue. Stitch scissors are usually straight and used to cut stitch. Hello guys.